Hi, do you suffer with debilitating back pain? Have you been having a struggle with going to work and performing the way you should, or being able to sleep at night due to pain, or even just being able to do your favorite hobby? I'm here to tell you that there may be an answer. Me personally, I had 7 herniated discs that caused lower back pain, and I had pain for over 23 years. I went to doctor after doctor, acupuncturist and orthopedic and medical doctor and osteopathic and chiropractors, and I just didn't seem to find the answers that I needed. And over a period of time, I was able to figure out that there's a 5-step formula on how to stop chronic pain, specifically from a bulging or herniated disc. And so over a period of years, when I discovered this, I started the therapy, and within 3 weeks, I had about 95% pain relief. And so ever since then, I've been learning more and more and more about how to do this type of thing with my patients and how to get them the relief. And now we've helped thousands of patients to get relief from chronic and debilitating back pain. So I want to tell you just a little bit more about how this works and how it helps you to get better. And basically what it does is it'll rehydrate the disc using spinal decompression. It's a system that we use. So there's several parts. Number one, you want to make sure that your spine is aligned. When the spine is crooked or out of alignment, it'll start to rub and wear and tear and build up damage to that disc area and to the nerve, and that can cause pain. And the longer it's there, it can get worse. Also, the disc itself can get pressure put on it when you have a misaligned portion of your spine. That pressure going out hits the nerve and decreases the body's ability to fend off that pain, and you end up with pain that can last, sciatic pain, or just pain that is severe or debilitating. And so we want to show you how to help that herniated disc, bulging disc, or just pressure on the nerve from the misalignment. And one of the fastest ways I've seen to do, after you're getting your spinal adjustment to move the bone back into its alignment, would be to do non-surgical spinal decompression. Non-surgical spinal decompression will actually rehydrate that disc by using a pumping motion. No shots, no surgeries. That pumping motion will rehydrate the disc and allow it to go back into its normal configuration. In other words, if it was bulging, to allow it to unbulge. Now, the interesting part is that if this bulge that goes out of alignment and is dehydrating the disc and causing pressure on the nerve, if it heals wrong and stays bulged, putting pressure on a nerve, or if it is decreasing that pressure or that fluid in the disc and degenerating that disc, if it heals wrong in that posture or in that position, it will last the rest of your life. It will become permanent to some degree, where you'll have this problem come and go the rest of your life. In other words, you'll be moving along feeling great, and then you'll just barely twist one direction and your back goes out on you. And so you've seen people that they very easily, their back goes out, their back goes out, their back goes out. It's because they never went through the process of healing so that their body could actually be well, and therefore they have this continuous pattern of pain that comes and goes, comes and goes. So non-surgical spinal decompression combined with the 4 other therapies, remember there's 5 therapies altogether. Today we're talking about non-surgical spinal decompression. And in the research and studies, it's been between 88 and 92% successful. I found that to be true in my office. 90% success for herniated disc and bulging disc, almost unheard of. It's amazing. And yet that's the results that we get into the office. So I had a patient come in, and this gentleman had been in the office, or had been in pain rather, for over 5 years. Matter of fact, he'd been on disability for 5 years and hadn't been able to work. And he'd been to multiple doctors, as you can imagine, because he wanted to work. However, nothing seemed to help. He was in terrible pain all the time, and really his quality of life was just nothing. So he was struggling to just kind of make it day to day. When he came in, I did the exam, and we do a 7-part exam. We'll explain that later, but in the video today. But that 7-part exam, what it will do is it'll pinpoint exactly what's wrong and what we need to do to help. And I found out he did have bulging disc in his spine. So we went to the 5-part treatment that we do for the disc issues. And as he went through the program, he started to improve, and pretty dramatically actually improved. And it took a short period of time, and then he was back up on his feet, and now he can live his life. He can go and go hunting, or he can go, and clean up the yard or the house, or he can even go back to work if he wants to. And to have somebody who's been in pain that long to be able to get out of pain, it just really, it made my day. It made my week or my year even, to be able to say, hey, somebody 5 years of pain is now out of pain because of the 5-step protocol we did. I think that's pretty awesome. So I want to see if there's any way I can help you the same. If you've been struggling, if you've been in pain, if you've had pain for years and years, and you're just not really sure what to do, I would like to tell you that there may be an answer. Come down to the office, get the exam to find out exactly what's wrong, what we can do to help. Now, the new patient special that I have for watching this video is that you can get the new patient $47 exam. Now, that exam includes a 7-part exam. We're going to be looking at going through the consultation. It's a 2-part consultation to ensure that, number one, can we help? So we're going to do the consultation is to find out, is this a condition we can help, and that sort of thing. And then 2, what's the severity of the condition? In other words, when you get to where you're beyond 85% damage in the nerves and in the disc, it's already too late to help that. And so that's one way of ensuring that you get the best quality of care. And then secondly, we go through the exam. So we're going to be looking at not only your symptoms, which is part of the problem, your pain, your numbness, your tingling, whatever it is you're dealing with, but also tenderness. How tender are the tissues, so we know exactly which part of the body we need to be addressing. How many nerves are involved. In other words, is it just a pressure on one nerve, or are there several nerves involved? We know which ones to treat and which ones to leave alone, or which ones that we actually need to focus on very specifically. We also measure the joints, or we examine the joints. This is a big, or rather very important part of the exam. If you can find out which part of the spine has joint pressure on it, usually that's going to tell you where you treat or what you treat. We also do a range of motion exam to see what areas of the spine are limited in their motion. We're doing a muscle strength test to find out which muscles are involved and which ones need help, to help you to rehab and become strong so that this doesn't come back in the future. And then we're going to be looking at the disc itself. Now, if the disc is bulged or herniated, that's when we start into a different process. If it's not bulged or herniated, then there's a 3-step process that we use to actually eliminate that pain. So all of your treatment is really based on this exam. It's very crucial that you do the exam properly, that you get all of the tests. And one of the most common things I hear, they went to other doctors and the test was short, or the non-existent, or they never took x-rays, or they don't have an MRI. And so if you have x-rays, if you have MRI, and they've been done recently, I'm going to recommend bring them to the office with you when you come for the exam, and we'll look at those. Have you had any nerve testing? Have you had any other testing that would help us to see exactly what's going on? And then if, in fact, it looks like that we can help, we'll also include doing one x-ray so we can see what's going on with you. And if it's something that we help with, and if it is, that'll tell us what we need to be doing from there. So that's how the 7-part exam would go, and that is valued at over $350. So, this $47 new patient exam, I'm definitely going to recommend get down here and get this. Now, it is a limited number of these that we can do each month. I can do 10 of these each month. So it's the first 10 people that give a call in each month that I'm able to do this exam for. So I want you to pick up the phone and give a call. That way I can see what's wrong. We can see what to do to help you. And is it possible to be helped? Is it possible that you could reverse this condition to get your life back to where you could actually feel good again, have the quality of life that you want and deserve, where you could go out and play with your kids or grandkids, or play golf, or just go for a walk or do some hiking. I think the biggest thing that I see people do is they'll want to go out and live a life and be healthy, but they find that this pain stops them. And so I'm just going to say, get down, get the exam. We do offer a 2-part guarantee on the exam. Number one, time, we value your time. So when you come in, after you fill out your paperwork, there's only less than a 7-minute wait time to get back to see the doctor. And then secondly is it's a financial guarantee. In other words, if you get done with the exam and you didn't think that it was exactly what you needed, or you're just not satisfied with the exam, before you leave the office, I want you to stop at the desk and let them know whatever it is you weren't satisfied with. And if we can't make it right, we'll give your money back right there on the spot. So that saves you and protects you. We just want you to feel comfortable all along the way. And so I'm definitely recommending, if you're suffering with back pain, if you have been suffering for a long time, I want you to get in and get yourself checked, find out if there's a way to help you, and if there is, then get on the right road to health again. So I will talk to you soon. Call the office now, 724-342-2225 to reserve your time.